Yeah, come in.
Hi, my name is Dr. James.
Yeah, hi, Dr. Stevens.
Yes.
I got a page from someone in ED. Do you know what that was about?
That was me. I was calling you to admit a patient, Mr. Smith. So Mr. Smith is a 64-year-old gentleman. He has a history of insulin-dependent diabetes. He's coming in with cellulitis of his right lower extremity. He's been on doxycycline for about 4 days. Unfortunately, despite that, he's not getting any better. So on exam, his vital signs are stable, but his right lower extremity, he has swelling and redness all the way up through his mid-calf with some streaking. His labs, his white blood cell count is elevated at 15.6. His ESR and CRP are slightly elevated, and his glucose is 275, so it's up a little bit. But having had the doxycycline for 4 days and not getting any better, I think we need to admit him for IV antibiotics.
I already saw and evaluated the patient, and I think he's fine to go home with close follow-up patient care.
Yeah, so, we tried the outpatient route with the doxycycline, appropriate antibiotic, and despite that, he's not getting any better, so I think we need to escalate the antibiotics.
Yeah, I took a look at the guy when I was down visiting my last admitted patient. He's fine to go home.
Yeah, so, he's an older gentleman with the insulin-dependent diabetes. His white blood cell count's already slightly elevated. I really think we need to try to control it better with some IV antibiotics, and then maybe go home later.
I took a look at the labs and the exam documentation, and the numbers didn't seem that significantly changed to me. I talked to him, and he admitted that he had been elevating his leg at home, but he can see his PCP in 24 hours.
Yeah. Do you mind if we have a seat?
Sure.
So he has been having some difficulty at home getting around, moving the leg and elevating the leg, as you said. I really think at this point he would benefit from getting some stronger antibiotics. I mean, as you know, individuals with diabetes sometimes they progress pretty quickly, and they can definitely get worse. And so I think he would benefit from coming in for the medicine.
Yeah, but we've already started him on antibiotics. Isn't that enough?
For him, I don't think it is. Despite the appropriate antibiotics at home, he's already getting worse. So I think he needs an escalation.
I don't see the need for him to be admitted. So can't we give him, IV antibiotics in the ED?
I agree he needs IV antibiotics. I can definitely give him the first dose of IV antibiotics in the emergency department, but I think he's going to need more than one dose. And I think, he'll need a couple of doses.
It's just every time that I listen to you all about admitting a patient that I don't think needs to be admitted, they seem to go home the next day after antibiotics.
And I think that may be a sign that the IV antibiotics are working, that they're not getting worse, that they're actually getting better and can't go home the next day. And that's, honestly, I would love if that happened with this patient. If they got admitted and, if he gets better, he can go home the next day, and I think that'll be great for him.
But just all this work that y'all are doing and this increased volume, it means increased inpatient volume as well.
I understand that, but I think the patient really needs, IV antibiotics to take care of this infection.
Can't you just observe him yourself? I'm sure that there's space in the ED somewhere if it is this important that he's observed for a while.
So, unfortunately, in our emergency department, we don't do observation care there. It's not the best place for the observation to occur. We have, I know that you're busy, but we also have quite a number of patients in our emergency department, in our waiting room. I really think he would benefit from being admitted.
Well, maybe one of your colleagues can evaluate him, and maybe they'll be more comfortable with discharging him.
Yeah. I think my colleagues would agree that at this time, discharging the patient is not the best option for him.
Okay. Well, what if I put a note on his chart that said that I'm the one that said that it was okay for him to not be admitted?
I think that's a possibility, but I still don't think that's giving the patient the treatment that they need, which is stronger IV antibiotics and observation.
But your increased volume means that we have full hospital beds. So we can only admit the patients who really need it.
I understand that. I understand about the crowding in the hospital. However, that honestly is a systems issue. And what I want to focus on is us doing the best that we can for Mr. Smith.
But doctors and patients make up the system. And we're only in this situation because of all these people that you're wanting to admit. And that's just another patient that's going to clog up the system.
Yeah, and I understand it's frustrating. In the emergency department, we deal with crowding too. So I totally understand that.
And you're not the only ones that are overworked. I have a long list of patients that ED wants to admit. It's overwhelming.
I understand that you're very busy and that the hospital is worked very hard. But I think what's really important is that all of those are system-related issues, and I really want to make sure that Mr. Smith gets the care that they actually need. I think we both agree that the patient needs IV antibiotics and a period of observation. I mean, do you have any other way to be able to get that for the patient? I'm open to suggestions, but I think that's what we kind of agree that the patient needs.
So you're saying bare bones, what is essential to this patient is?
The IV antibiotics and being able to get reassessed.
I mean, I want to help. I don't know what to do here.
I don't know any other way to get the patient that IV antibiotics and the observation. If you have any other suggestions on how we might be able to accomplish that, I know we want to do what's best for the patient.
I'm not sure.
Is there anything I could do to help you with the process?
I'd like to admit it, but honestly, that means that I'd have to call an endocrinology consult, get discharge planning, talk about bed placement.
What if I help you with some of that? What if I get the endocrinology consult? Will that help the process at all?
That would take something off my plate. That would be helpful. Yeah.
Excellent. I'll do that. I'll place a consult for endocrinology, and then we can get the patient admitted.
Okay. Yeah. If you can do that, I'll get everything else going on my end there. Okay.
All right.
Good. Yep. Sounds like a plan. All right. So you can get that going. I will. I got to get my other admitted patients set up, and then we'll get this thing going.
Thank you.
Yeah.